So I just wanted to welcome and thank you for joining us today. My name is Jordy Hermiston. I'm the program facilitator of family services with BC Transplant. This is BC Transplant's first fall speaker series, and our topic today is improving engagement and empowering patients on their transplant journey. I'd like to recognize that we have people participating today in this webinar that are from First Nations lands across BC and Canada. However, I'd like to acknowledge that at BC Transplant here, we acknowledge with gratitude that we are hosting this presentation on the traditional, ancestral, and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh First Nations. A bit of housekeeping. So just wanted to give everyone the heads up that this webinar is being recorded and will be available afterwards. We'll send it out to all those that are registered participants, and it'll be available for you to review. If you've joined the presentation and your default settings will have your audio and video muted, there will be time for questions at the end of the speaker's presentation, and you can submit your questions in two ways. First, you can raise your hand, and then we'll unmute you, and you can ask your question verbally. Alternatively, you can type the question into the Q&A pane found in the Zoom toolbar at the bottom of the meeting window. The chat function we've turned off, and this just helps us monitor your questions more effectively through the Q&A pane. So without further ado, I want to turn it over to our speakers for today. First, we have Christy Coldwell, who is the Senior Advisor for Research Advocacy with the Transplant Research Foundation of BC, and she's joined by Lydia Lauder, who is the National Director of Programs and Public Policy with the Kidney Foundation of Canada. So I'll hand it over to you folks for your presentation. Thank you.
Thank you so much, Jordy. And I'll just take a moment to share my screen, and then we should be good to go. All right, can you see my screen?
You're good.
Fantastic, thank you so much. Just make one change, thank you. All right. Before we begin, I'd like to recognise the Indigenous land that I am on. I live and work in Toronto, the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is home to many diverse First Nations, Inuit, and Métis people. I also acknowledge that Toronto is covered by Treaty 13, signed by the Mississaugas of the Credit, and the Williams Treaty, signed with the multiple Mississaugas and Chippewa bands.
And Lydia, I would just like to acknowledge as well that I'm joining you from the traditional unceded territories of the Coast Salish, the Stolo, the Kwantlen, and the Katsis peoples. Thank you.
Thanks, Christy. And there's a photo of us, and we'll just move that slide on, Christy.
Because Jordy already did our intro, so.
That's right. So today we're going to cover a little bit about learning through living. We're going to describe what the Organ Donation and Transplant Collaborative is, as well as the PAC. We're going to talk about patient, family, and donor engagement. A little bit about the project that we worked on, the goals and activities, the results were of the themes and opportunities that came out from the project, the patient-centered recommendations that were made, and the knowledge translation pieces that we have developed as well. So Christy, I'm going to hand over this next slide to you.
Thanks, Lydia. So I just want to take a moment and also acknowledge that I am the patient partner lead for this project. I know Jordy acknowledged my professional capacity, but I think it's important to note that I have a great deal of experience as well with our organ donation and transplant system as a patient. And that's actually what I want to take a few minutes of your time right now and talk about, share a little of my own transplant journey. And it's important because bringing you a lived experience perspective on our ODT system, it really helps ground the project that we're talking about today, but it also really highlights that patients, families, and donors have a voice and need to have a role in helping bring about change in our organ donation transplant system so that it is much more responsive to the needs of our patients, families, and donors. And so, as a recipient, as all recipients, we all have a unique story to share. But the one common thing that we do all have is that we are alive because of an organ donor. I am talking to you today because of the heart that beats in my chest. I had congenital heart disease and I underwent various open heart surgeries and procedures in my childhood, my adolescence, and then finally, when I was 17, discussions around transplant began. And I knew very well that if there was a chance, no matter how small, I absolutely had to take it. But that did mean that my mom and I were going to have to pack up and leave the only home I had ever known for a very strange and unfamiliar city, as we were going to have to move to Toronto, where I would be listed at the hospital for sick children. I knew no one and nothing of this place. And when I said goodbye to my family and my friends, I honestly didn't know if I was ever going to be seeing them again. The wait for a donor heart or any organ is really, it's indescribable. And unless you've been in that position, unless you've been in those shoes, you can't possibly understand the burden and the stresses that accompany it. It's really insurmountable. There's the financial, there's the emotional, and all the while you're watching yourself die a little more every single day. But I was fortunate in that only after a 3.5-month wait, I received a call that they believed they had found a donor heart for me. And I remember the night as my mom pushed me across the street in my wheelchair over to the hospital from our apartment where we were living at the time. I looked up at the sky and I thought of my donor and I thought of their family, but I had to tuck that away. I really needed to focus all my energies on the task at hand, and that was on surviving. And survive I did. I survived a grueling 12-hour operation. I endured a cardiac arrest a few days post-transplant, as well as numerous bouts of rejection and infection and turning positive for the Epstein-Barr virus from my donor. That first year post-transplant was incredibly difficult. I think it is probably the most challenging time of my life, even all these many years later. But I survived, I prevailed. And, as I became stronger, the other elements, they weren't progressing quite as readily. The heart was doing great, but there's other pieces that weren't doing so well. It was a lot to try to accept the fact that I was alive because another person wasn't. And because I was alive because of the stranger's heart that actually beat in my chest. And there would be times that I would catch my own mom crying and I'd ask her, I'd ask her what was wrong. And she would tell me that she just didn't know, that she was still very much back in Toronto. She could hear the beeping of the machines. She could hear and smell all those smells that accompanied the ICU, and she didn't know how to escape it. Of course, all these years later, now I know she had a form of PTSD, and I'm sure I did as well. But the focus was on the heart and how well I was doing physically, and much less on those other variables. And so we did what we did best. We carried on. And this August actually marked 22 years of life for me with my transplant. And in those 22 years, I have been able to accomplish things that I really only used to dream would be possible. I went to my prom, I graduated from university, I fell in love, I got married, and I am now a bona fide crazy dog lady. That if you know me, you can attest to that. At any given point, I have probably 4 or 5 little senior rescues or palliative dogs. I'm very much hoping that my crew of misfits here cooperates for the remainder of this presentation. But it also means 22 years of taking daily and potent, as well as at times toxic medication that not only lowers my body's ability to fight infection, but also takes a pretty significant toll on my overall system, resulting in various comorbidities. And these are comorbidities that I struggle with on a daily basis. I don't know how long my heart is going to last, but I know that it won't last forever and that I will undoubtedly require another transplant one day. But I don't know if my heart or if my body is going to be strong enough to withstand the rigors of another transplant surgery, or if my other organ systems will be able to endure all that accompanies that. So as a transplant recipient, it takes a lot of courage to navigate the complexities of post-transplant life and to also face the many uncertainties that await us. Every time I lose a friend in the transplant world, which sadly happens all too often, I do have those thoughts. I wonder, what is it going to be that finally takes me out? Is it going to be cancer? Is it going to be an infection? Is it going to be the cardiac allograft vasculopathy, a form of rejection? I don't know. But I have hope, just as I have had over the last 22 years, because over the last 2 decades, I've witnessed firsthand how far transplant medicine has evolved, in part due to the advances of science and research, but also because greater recognition is finally being given to the role of patients and families in ensuring our system is much more responsive to their needs. But that being said, there's still so much work that needs to be done. Our patients of today are becoming increasingly more complex than they were 2 decades ago, and we need to ensure that our system evolves to better meet those needs and to ensure that our system is more equitable, that's more transparent and accountable, and that it really is hearing what are those needs as defined by patients, families, and donors, not for patients, families, and donors. Because we must remember that this is our life. We are the ones that live this day in and day out. We don't get a holiday, we don't get a break, and we can't leave it at the office. And that is why I am so excited to be able to share with you this project on improving engagement and empowering patients on their transplant journey. Because these are the questions we asked. We asked our patient, what is it, patients and families and donors, what is it that matters to you? And what is it that you see needs to improve? And this is a project that is for patients and families by patients and families. Next slide, please. So this project is actually part of a much larger initiative known as the Organ Donation and Transplant Collaborative. So the collaborative is a time-limited initiative that is led by Health Canada with the goals to bring about system improvements that result in an increase in the number and the quality of successful transplants and improvement in patient and outcomes. And central to this process is bringing together key stakeholders from across our country, from researchers to clinicians, to organ donation organizations, to provinces and territories, as well as patients, families, and donors, just to name a few. Next slide, please. So the collaborative very much recognizes and respects the importance of including lived experiences of individuals in our organ donation and transplant system. And to that end, they have created the Patient Advocate and Advisory Committee. The PAC, as is commonly referred to, is a formal structure in the collaborative that really brings together diverse and robust voices from our recipients to donor family members to living donors, as well as caregivers and patient advocate organizations, and embeds these perspectives throughout the work of the collaborative in individual working groups, activities, as well as projects, and ensures that these voices are involved in the decision-making as well as priority setting. In fact, this project was actually initiated from our PAC members. Next slide, please. And so you may be wondering, why is it so important that we have a project that is patient-initiated and patient-led? So it is important that we have research that is not only funded, but undertaken by these individuals who are most affected by the system, because it really helps to ensure that we are addressing key areas of importance as defined by them that they have identified as mattering. And through this work, we have helped to ensure that they set the priorities, and we have also engaged them every step of the way. Next slide. Oh, hit another button, Lydia.
There we go.
Thank you. And so I do want to just take a couple moments here and provide sort of a high-level overview of what this engagement in this work actually looked like. So right from the very beginning, our PAC members or patient family donor partners were instrumental. So they helped to reaffirm the importance of our research question. They worked with us to define the project goals as well as our project outcomes. And then when it came to networking, we looked to them to help us really form connections with the larger PFD communities and make key contacts. And this was key because this really helped to ensure diversities in perspective, as well as greater representation from across our country. It also laid the foundation for the work that was to come in our questionnaire and our focus group. And regarding our resource inventory, that I know Lydia is going to touch on very shortly, we really look to our PFDs, to their expertise to help us identify and to compile relevant and useful resources and supports and tools that would be seen as having an impact and being of use and applicable to other PFDs. And for our survey and our focus groups, we look to them to help us co-create many of the questions that were included, to refine these questions, as well as to participate in the usability testing. And this was key because we really wanted to ensure that what was going to be asked was going to address those key areas that were the focus of the study. And for our final report, we look to them to provide guidance and feedback on the final recommendations. And for the knowledge translation, which we'll also touch on a little more later, they were really instrumental to providing guidance to ensure that our knowledge translation strategy was broad and that it was going to reach a wide ranges of audiences. Next slide, please.
Thank you, Christy. Sorry, my mouse has gone crazy there. So the project was to help the Organ Donation and Transplantation Collaborative to have a better understanding and being able to address the patient's lived experiences and to meaningfully inform its recommendations to the federal and provincial territorial governments on a new path forward for the organ donation and transplant system in Canada. In order to achieve this, we set out to improve the products and services available to all transplant patients and their families, empower people to navigate the system across jurisdictions and to advocate for their own needs, and develop patient-led and patient-focused approaches for renewed and improved ODT policies and services. So how did we do this? How do we start? Well, we first of all started with an inventory of resources. We completed the online survey and we also held our focus groups, as Christy has already mentioned. I'm just going to deeply dive into these a little bit further. So the stakeholder network and patients themselves helped us to develop a large inventory of resources available to patients from across Canada. These included everything from program information through national organisations such as the Kidney Foundation and the Liver Foundation, as well as the Canadian Blood Services, to resources from individual provinces and territories, educational material from individual transplant programs, just like you can see here a few examples of these. The topics run the gamut from financial support, medications, disease-specific education, post-transplant exercise programs, mental health, vaccines, and many more. Throughout the project, we've been sharing these resources with people in need of help navigating the transplant system. As part of this project, there are two main ways in how we planned to gather information and how we accessed that information. We also, as part of this, the information that we gathered was on the accessibility, responsiveness, quality, sustainability, and accountability of the ODT system. The first way we did that was through the online survey. It was open to anybody on a transplant journey, as well as their care partners and living donors. As Christy mentioned, our patient partners in the pack were instrumental in developing and pilot testing the questions that were ultimately used in the survey. The questions included topics and questions specifically on demographics, general questions about transplant, products, services support, navigating the transplant system, living donation, and timely COVID-19. The survey was made available online in 5 languages, and ultimately 994 people across Canada shared their transplant experiences with us throughout the online survey. Click again. There's a wealth of data from the survey, but for today we'll focus on this question, which relates directly to what we'll be discussing after this. Participants were invited to select from a list of 7 concerns of the ones that applied to them. These were the top 3: mental health, financial concerns, and coordination of care. They identified mental health, financial concerns as their primary concerns as they navigated through the transplant journey. With regard to mental health in particular, something we heard from people is that while their physical care appeared to be well in hand, support in the way of mental health felt like an afterthought to them. On the financial side, we've found that many needed services and resources that aren't necessarily covered, and that impacts people's ability to participate in the transplant process. Depending on the jurisdiction or particular situation, services may not be available when needed. It may be difficult to access them, or people were not even aware that they exist. Coordination of care was also an important concern, and there was much discussion about the role of the primary care physician post-transplant. The second way we gathered information on the ODT system in Canada was a set of focus groups. There were 4 groups in total for a total of 20 participants. We met virtually twice last year, once in the spring and once in the fall. The first online focus group included questions that delved further into the lived experiences, and we also asked about the survey, and the second focused on some of the themes and opportunities that arose from the first round of the focus groups. Once again, we worked with patients and families and donors in the PAC committee to develop the focus group questions, which would help us understand the lived experiences of people on a transplant journey. We were able to have the focus group participants from across Canada and also across all organ groups.
Sorry, Lydia, I had to unmute. Sticky unmute button. Sorry, everyone. So what did we learn? So from our analysis of our focus group data, it revealed some key themes as well as important opportunities that led us to our patient and family focused recommendations related to our system. Next slide, please. So we'll start with themes, keeping in mind, of course, that this project is fundamentally about amplifying our patients' and our families' voices. So our first theme focuses on holistic person-centered care. So as one of our focus group participants shared, regarding mental support and financial support and emotional support, they all go hand in hand. So many of our focus group participants said that there was a real emphasis on the medical aspects of their care, and suggested that a more holistic approach was needed with continual assessment throughout the transplant journey. So another important theme that reoccurred throughout our focus groups was around accountable care. So one focus group participant actually shared that they had a lot of questions around healing post-transplant and they weren't sure who to contact, as you can see from this quote. So overall, many of our participants reported feeling in the dark about their care with a lack of control, poor communication, as well as a lack of transparency. Next slide, please. So another theme that emerged was centered around the collective impact of the transplant journey on all of those in the individual's network. So one of our participants shared that I think the whole journey was rougher on the people around me than it was on me. So it can be challenging to find a balance between life and other medical demands and those related to transplant, with many of our participants sharing that having hope, support, and empathy on the journey is critical. So many of our focus group participants also talked about how difficult it can be to navigate the uncertainty during the transplant journey, particularly in the first year post-transplant. The journey isn't clear-cut, and participants reported that it can be very difficult to live with not knowing what the next challenge is or when the next obstacle is going to arise. As this one individual shared, thinking about going through a transplant or even starting the workup towards a transplant, it's scary for everyone, and it's completely normal. Next slide, please. So our next overarching theme was connection, with many participants talking about how important meaningful connection is on the transplant journey. That connection can come in many forms. For example, it can be between recipients and donors, from family and friends, professional support, as well as peer support, as you can see in this one quote. And then finally, our final theme is around advocacy. So many of our participants spoke about how important it is to be able to advocate for yourself on the transplant journey and that it can lead to better care. However, they said this wasn't always possible because at times they weren't sure what their rights were, and they also encountered other barriers that made it difficult. Some of our participants had a great deal of concern for other individuals on the journey who may not have the capacity to advocate, as is explained here. What I'm really worried about is people who can't or who just don't have the skills or are so sick that they can't advocate for themselves.
Thank you, Christy. And now we're going to talk a little bit about the 6 opportunities for improving the ODT system that were first raised during our focus groups. Firstly, enhance mental health support. Unaddressed mental health concerns were very common among participants, and many reported that meaningful mental health support was lacking or it was inaccessible to them. One person they'd like to see better access to mental health services before and after transplant. There's so little help, and what there is costs too much for those of us who have been on disability because of our illness. Help is completely inaccessible for many of us. Next, peer support programs. Nearly 70% of, sorry, I didn't have it up there. Nearly 70% of survey respondents reported that peer support or mentorship programs were not recommended to them. And focus group participants described themselves having to seek it out for themselves. They also said that while the Kidney Foundation's peer support program is robust and comprehensive, other organ groups lacked in these type of formal programs. The next opportunity derived from the focus group discussions was to improve continuity of care. And I'm quoting here, "In the process of being listed and delisted, I felt that a lot of the information was not being channeled to me in an appropriate or updated manner. Knowledge acquisition also proved to be an important opportunity for improvement from patients' perspectives. Our participants talked about the timing and amount of information shared with them and talked about the balance needed between the two. Overall, it was important for participants to receive information at the right time and also in the right environment so that they didn't feel rushed and could engage in an authentic conversation about their questions and concerns. One of the key opportunities identified, and this touches on many of the themes we've talked about, is expanding financial support for those on a transplant journey. Many participants reported difficulty in accessing affordable and appropriate services, including physical rehabilitation and professional mental health support. Other financial barriers included travel and living expenses, medications, and more. They reported that the supports that do exist can be difficult and confusing to access and may involve a copay that remains a financial burden. And then finally, we learned that the pandemic led to quite a bit of anxiety on part of patients and caregivers. Anytime I have to go out or be around people, I just minimize the risk at all costs, like shopping early, shopping online, just not being around people. I haven't seen my kids in 2 years. At the same time, we learned some important lessons during the pandemic, and perhaps the most important was that virtual care options, where possible, can greatly increase accessibility, especially for those in rural or remote communities. We also learned that better coordination of care is not only possible, but key to a positive transplant experience.
And now on to our recommendations. So the first of these broad recommendations is to prioritize mental health awareness and support. So this was seen as key to reducing stigma, to increasing transparency, and to helping normalize the conversations around mental health support for living donors, for recipients, as well as caregivers. And to help accomplish this, we need to integrate meaningful professional support for mental health through referrals at key points throughout the transplant journey to ensure that healthcare providers have the quality indicators and the resource needed to support patients, and also to create peer support groups that are linked to transplant programs, but ensure that these are also accessible for all organ groups.
The second The second recommendation is to expand resources and services to ensure equitable care for all of those on a transplant journey. Here we're talking specifically about exploring and expanding options to increase navigational support during the transplant journey. Establish and or support an existing central online pan-Canadian repository of education and resources for all of those on a transplant journey. Reduce the financial burden for patients and caregivers. And finally, support patient advocacy for those on a transplant journey.
So our third and final recommendation is to improve the coordination and the continuity of care. We need to ensure the communication between and within our healthcare teams to the patient is actually meeting the needs of that patient and their caregivers and their family. Ways we can do this is to establish comprehensive care programs, to increase support for primary care providers, including general practitioners who often care for transplant patients, build on the frameworks that have been established during the pandemic, again, for those people who are in those rural and remote communities, especially farther away from the transplant centers, to really maximize that virtual access to their transplant clinics and centers and for their care. Next slide, please, Lydia.
Thanks, Christy. So this project sought to highlight and document the lived experience of patients, living donors and caregivers on their transplant journey, and to propose patient-led and patient-focused recommendations for the renewal and improvement of the organ donation and transplantation system in Canada. Sorry, my dog's decided to cry just as I've started doing these slides, my apologies. The recommendations outlined in this project concerning mental health, access to resources and coordination of care represent the most common and pressing needs articulated by over 1,000 survey and focus group participants from all across Canada. They offer tangible, implementable and measurable solutions to address the many challenges faced by patients, living donors and caregivers on their transplant journey.
And now on to the knowledge translation portion of this work. So we opted to really gear and focus onto three main audiences or groups. This includes our patient, families, and donors, governments and organ donation organizations, as well as the research community. Again, we really stayed closely aligned with this overall approach that we had followed throughout the project up until this point. And as such, we really looked to our PAC members, again, to those PFD partners, and to really seek their feedback and their guidance on how we could develop knowledge translation strategies, as well as tools and methods that would have a broad reach and would really also achieve the goals, but reach individuals who were perhaps not from the more traditional means of academia, but were also sort of those boots on the ground, patient family donor organizations, as well as individuals throughout our country. Slide, please. And so for our patient, family, and donor audiences, we have our project website. Now, this was created very early on in the project and helped serve sort of as that base for a lot of this work. But what we have done is continue to keep it operational and update it on a regular basis as material is produced. And one of those materials that we have been able to create was a project snapshot. So this is more of a succinct sort of overview summary of the work and the findings to date. And we ensured that this was shared back to the individuals who participated in those questionnaires, as well as the focus groups. Of course, knowing very well that not everyone is going to want to sink their teeth into that multi-paged final report, but nevertheless, the snapshot, as well as the final report, is made available to anyone and everyone who would like access to it. And you can even find it on our website here. And we have also hosted various webinars, including one this past summer where we were part of the Patient Family Donor Forum as part of the Canadian Donation and Transplant Research Program. And we have another forum planned in the coming weeks for our PFD community through the Kidney Foundation. And this is by no means an exhaustive list, but these are really the key highlights around what we have created for patients, families, and donors.
Thank you, Christy. Next, how will we make sure that the voices of the transplant patients, caregivers, and organ donors who designed, supported, and participated in this important work are heard by the healthcare system? The final report of the project has been released and shared in English and French. And we also have a brief stakeholders report to help governments, organ donation organisations and transplant programs to identify how they might participate in improving the transplant journey. We've presented the results of the study to Organ Donation and Transplant Collaborative, and also sharing what we've learnt through forums like this one. We'll also, of course, be looking to our PAC members to offer further advice on ways of sharing these results and promoting the uptake and implementation of the patient recommendations we've told you about. And finally, we've had the opportunity to present our work at multiple meetings and conferences, including the Canadian Society of Transplantation and the Canadian Society of Nephrology conferences. The research group within our team is also preparing 3 separate papers for publication in peer-reviewed journals. These papers will help share our patient-led research process and results with the research community.
That darn sticky mute button. And so in closing, I really want to emphasize that this project has taught us how important it is to understand the lived experiences of our patients, our families, and our donors to help create and to support an organ donation and transplant system that better meets the needs of those that it's intending to serve. But central to doing this is to take the time on an ongoing basis to ask, listen, and learn from these individuals in order to understand those experiences and to be able to empower them. Because remembering that lived experience truly is priceless.
And finally, I just wanted to thank our project team, Christy, our project manager, Carrie Thibodeau, who's not here today, and also our research team, Dr. Sandra Davidson, Dr. Sandra Jewell, Mark Hall, and Danielle Fox. This project was funded by Health Canada and was led by the Kidney Foundation of Canada, with research expertise from the University of Calgary and support from the Canadian Transplant Association and the Canadian Donation and Transplantation Research Program. So finally, a big thank you, and thank you for the opportunity to be here today to present our project.
Thanks, everyone. Thanks for joining us.
Thank you so much to Christy and Lydia. We have some time for questions now. I'm going to start us off and just reminding you, to raise your hand and or go into the chat. I'm going to start us off with just one question that we got before the presentation. And it reads as follows: what factors did patients identify in ODT that most negatively impacted mood and anxiety, and what promoted effective coping?
Yeah, thanks a lot, Geordie. There was a lot of discussion, particularly in the focus groups and as well in the surveys, about mental health and how it had impacted patients as a whole. What we've just presented here today is very much a summary of what we've seen at those levels. And I think to really give this a little bit more further light, have to go back to the report. But what we did here specifically in the focus groups was that people had varying levels of communications, didn't know who to turn to when they did need mental health support, were often scared to present their mental health problems to their healthcare practitioners as they feared it may be harmful to their listing on the transplant list, or it may impact their future care. Christy, did you want to add?
I think, and we will provide links to the final report where you can look a little bit further into these specifics. But I think one thing that was also important to note was that regarding mental health, that it was often seen as a checklist, particularly during the pre-transplant period when you were being evaluated for transplant. It was something that you had to ask. And again, there was a lot of I don't know how to describe it, but it was a lot of individuals shared that they felt very much they needed to be guarded around how much and how forthcoming they were and what they shared to their team. And as Lydia alluded to, that also very much carried through to the post-transplant immediately, but also very long-term, because they didn't want it to impact their care. So there was a lot, I think, of barriers around that, and there needs to be more openness related to that. And they need to know that it wouldn't impact their care, because often what was happening is they were going sort of behind their team, not behind their team, but there wasn't that openness that they were getting this support, and they didn't want to seek it from their transplant center or their team because they didn't want anyone to potentially doubt or have second guesses around their stability or how they were coping, and ultimately how that would impact how their care was delivered to them.
Thanks for that. I saw someone raise their hand earlier, but maybe they put their hand back down. I don't know if there's oh, I see now. Polly. Go ahead, Polly.
Hi, everybody. Thanks so much for the presentation. As a social worker in a transplant program for almost, dare I say, 20 years, this is like music to my ears, truthfully. The question I have for you is, how do we work within a very medicalized system to acknowledge and advocate for these psychosocial considerations, really, as it relates to transplant? I feel that it's an uphill battle to get medical systems to recognize kind of the comprehensive and holistic nature of lived experience and psychosocial complexities for patients. So I'm just interested in your thoughts moving forward about how we can increase funding in this area.
Well, that is a good question. Lydia, please feel free to jump in by all means. But I mean, I think the funding is always, it's that elephant in the room, right? That is the biggest sort of barrier to all of this. But I think, in part, it can be about having champions in our system who recognize this, who don't just accept it, who don't just accept the status quo, and take the time, as I mentioned, to really hear from patients, families, and donors about what's going on, and to, where possible, take steps to really make the effort to address those. So even regarding I know there's some research programs that are in operation that are really seeking to explore this as well, because as we know, the data is so critical to back that up. But Lydia, what else do you think we could do to help advocate for that?
Yeah, and I think we're looking at this at a very sort of high systems level, and this is the reason that the collaborative exists, is to really look at where there's opportunities to improve the systems and to make it easier journey for people as well. So I think, not only are we working at that champion level at those units, but we're also looking at that governance level as well. So it's multifaceted. I wish there was an easy answer, and I think we just really do have to chip away at it. But I think being invited to speak to provincial governments, to speak to territorial governments, and also at that Health Canada level, I think will go a long way into sharing those experiences and being able to be that voice for those patients who have so kindly and generously spoken up as part of this survey.
And I think the other thing to note is that we don't necessarily have all these answers. We wish we did, but that there's not necessarily been any formal work done that can really, as this study that has really, I think, brought to light these in this formal sense, backed by the data from across our country. And I think that is really key to starting this work and to bringing about those changes. And so even though, like Lydia said, we'd love to have these answers, at least we're starting to talk about it, and we're really recognizing, as you mentioned, you're very well aware of this, but there's so many other individuals who work in our system that aren't, and they need to also be educated about it.
I have another question in the chat here from Ranj. Is any active advocacy occurring at provincial levels to explore increasing funding to support pre-transplant and post-transplant costs? For example, the cost of travel to pre-transplant assessment, dental needs, an average 3-month stay in Vancouver post-transplant. Those in income assistance or eligible for funding from the First Nations Health Authority can obtain support, but many individuals fall between the cracks currently.
I think it's a very similar answer to the question that we just had previously as well. At the moment we're presenting this information and data to the provinces and highlighting the need for support. We're highlighting the financial stories that the patients have shared with us as well. But I might refer to Christy for that more of a BC perspective.
Oh, good golly. You know what, Lydia, I am not 100% sure, but I would also say that what we did through this work was that we, hearing from our patients, families, and donors helped us to better understand the disparities. So even though that may not be incorporated into the report, the specifics of each province, we do have a better sense of what is available and where those lacks and those gaps are. And again, because we have that direct link back to the provinces, to the territories, they're hearing about this. And I think we're finally kind of bringing it to light, whereas before everything was so siloed and really existed within its own province. And as the patients, families, and donors are coming together and are also starting to I think, have a stronger voice in this, they're also not just taking it sitting down as well. Granted, they can't do it all on their own. We need those individuals at the various levels when it comes to provincial, territorial, and federal as well. But yeah, and again, I know that doesn't exactly answer your question. I wish we had more specifics and more answers, but we don't necessarily have those to offer you.
Another question come in here. What is the most important message from patient, family, and donors to healthcare workers?
That is a very loaded question. And I don't know if we can say there is one specific message. And I know I can't, because I can't speak for all of our patients, families, and donors. But that being said, I do think, again, what I mentioned sort of wrapping up is that you need to be listening to the individuals in our system who have this lived experience, because you may think you know, but you don't necessarily know, because these are the individuals who are living with this. They're the ones navigating, they're the ones struggling. And I think when we come together, that's where those true gains can be made. So just remembering the power of that voice, and when in doubt, or when whatever it may be, when you're talking about a program change or a policy or whatever it may be, have you considered integrating those lived experience voices, those perspectives, to truly ensure more comprehensive comprehensive picture? My guess is a lot of times no. And I think that's what needs to change as well. And so if anything, that message about ensuring that voice is very much included in those discussions. Lydia, do you have anything to add there?
I think you very succinctly covered that. I don't really have much more to add. Thanks, Christy.
But again, I encourage you, and we'll share it with you in our chat, to have a look at the final report or our website, where you can access that short summary, because there's a lot of really great knowledge and information that we heard from the PFDs in there for healthcare professionals specifically, and broader, of course.
I have another question come through. How can we as frontline workers help with this? As Polly said, even when we know the struggles, we are often are the ones having to tell the patients that we don't have resources. And even though we know maybe what is needed and what could help, it's a really hard place to be.
Oh yeah, and we hear that a lot, and we really do acknowledge how you feel in that situation. But I think getting informed, learning about the stories, reading the reports, just getting a better understanding of what the patients are saying, and being able to listen, as Christy said, I think it's really, really important. Listen to what the patient is really saying. That I think comes out as paramount. Christy, was there something else you wanted to add?
I would just add to that I think so as patients, we very much recognize our healthcare professionals are considerably overburdened, and you guys are doing the very best you possibly can with limited resources, with huge patient loads, with time constraints. But that being said, we also heard that a lot of times they're not, our healthcare professionals may it be social workers or psychologists or whatever it may be, they weren't always aware of the resources that were out there in the community and that were available. So as Lydia said, you can try to explore those, educate yourself more. There's a lot of informal and formal ones, and you can also check with your patients as well, because they're a huge source of knowledge. They know connections, such as whether it's more along the patient lines or other resources. And then again, there are those resources that we have compiled, and that is a resource. There's other resource sort of banks through the CDTRP that have been created, but just becoming more aware of what's out there that you can help direct your patients, families, and donors to, I think can also go a long way. You may not have the best answer, you're not going to have a solution, but at least a little more knowledge, because that really is power.
Yeah, and I'll just add to that, Christy, places such as the Foundation also do provide short-term financial assistance to patients. With kidney disease, I'm not sure about the other health charities, whether they're supportive, but there are some resources out there that you can tap into and speak to your local organ group or health charity as well.
We have just a couple more minutes if there's any other questions. It doesn't look like it so far. So I guess in closing, I just really want to thank again Christy and Lydia for attending today, and then all of you as well who joined us. When the session is ended, your computer should open to a new page requesting that you complete a webinar feedback survey, which would be really helpful for us thinking about our future programming and how this worked for folks. You'll also receive a follow-up email that includes the link to the survey if you want to complete it later. If you would like to register for the other speaker series sessions, we have 2 more. The next one will be in 2 weeks, and then 2 weeks following that. You can do so at our website, so transplant.bc.ca/education.